Chronic kidney disease is a serious health problem. The number of people with impaired renal function is rapidly rising, and atherosclerosis is common in these patients, and CVD represents a major cause of death in these patients. So let's find out a little bit more, particularly about maybe how to lower some of this risk. We have Dr. Hayes Dansky with us, who is a therapeutic area leader in the field of cardiovascular at Janssen Pharmaceuticals, Inc. And we're talking about on-treatment outcomes in patients with worsening renal function with rivaroxaban compared with warfarin. This is from ROCKET-AF, correct?
Right.
So why did you undertake this particular analysis of ROCKET-AF?
Yeah. So first of all, one of the challenges in patients with non-valvular atrial fibrillation is worsening renal function. And this is something that can occur over time in this patient subset, that patients with comorbid diseases like diabetes can have a decline of renal function. So it's important to study, and actually also patients with declining renal function with non-valvular AF actually have a higher risk of stroke than patients with normal renal function, and furthermore, on oral anticoagulants have a higher risk of bleeding. So it's very important to actually evaluate the efficacy and safety of treatments to reduce the risk of fatal or disabling stroke in these patients.
So there's a sense of almost a perfect storm in both risk of a stroke and risk of bleeding.
That's right, right, and it's the benefit risk that is extremely important to make decisions on what's appropriate for any given patient. So this study was a subset analysis of the ROCKET-AF trial. This was the pivotal trial that led to the registration of Xarelto for patients with non-valvular atrial fibrillation. And what was done in this trial is that there was a subset of patients that had declining renal function during the trial, which was defined as a 20% reduction in creatinine clearance. And what was looked at is the efficacy of Xarelto versus warfarin, both from a point of view of stroke, as well as major bleeding. And actually we're really reassured that actually the risk of stroke, the number of strokes were reduced on Xarelto versus warfarin, but actually there were no differences in major bleeding. And this actual data was very encouraging for patients whom physicians are looking at whether to, what anticoagulant to choose for their patients. So Xarelto remains a valuable option in these patients to reduce the risk of stroke.
Are some of these patients not being treated now, perhaps because of the high risk they have of bleeding?
Yeah, so any patient, patients who are candidates for anticoagulation to reduce the risk of stroke, physicians have to weigh the benefits and risks, and yes, patients which have worsening renal function, because they have a higher risk of stroke and a risk of bleeding, a physician always has to evaluate each individual patient and decide based on the benefit risk.
Well, I thank you very much, and I suspect we're still going to get more data out of ROCKET-AF over the course of time.
Yes.
I just know there's a lot of data and some analysis, and there's still some to come, correct?
Yeah, absolutely. There's been data that's been rolling out over time. There have been multiple publications looking at different subsets of patients. We think this data is really important to equip physicians and patients with important data to guide the treatment decisions made.
Well, the July issue of CardioSource World News had a cover story on this kind of renal and cardiovascular connection. It was probably one of the more interesting clinical covers that we have done in the last year or so. So please check that out. And for the rest of the coverage from the AHA meeting, please check online and in CardioSource World News, where I'm Executive Editor Rick McGuire.